So as it relates to triggers, some people are told about this concept of the migraine threshold. Can you tell us a little bit about that?
So, the migraine threshold is really describing how easy it is for you to be tripped into a migraine. So, if I were to put you on an aeroplane for 3 days, feed you 12 bottles of red wine, and not let you sleep, it's very likely that you would experience a migraine attack. The a person who has a susceptibility to migraine or gets migraine a lot will be tripped over into migraine much more easily. So the same exposure would definitely cause a migraine in someone who has that susceptibility, and even quite a minor trigger, exposure to cigarette smoke, for example, may be enough to trip that person in. So it's really how how much of a hair trigger you're sitting on to have a migraine event triggered.
So one thing I've noticed personally is that when I get a good night's sleep and I'm exercising and eating well, my threshold actually changes. Do you have the sense that migraine thresholds are genetically predetermined, or is there some room for movement based on maybe some behavioral lifestyle factors and even some medication and treatment that you're receiving?
Absolutely. So I would conceptualize it as you're born with your migraine threshold at a certain point, and you can shift that threshold by lifestyle interventions. So, by eating regularly, by drinking lots of water, by getting a consistent amount of sleep every night, and being on medications if necessary. All of that is going to increase your threshold, so increase your tolerance to those triggers. Uh, Likewise, you can drop that threshold down if you sleep really erratic hours, and get on a plane. All of those things can lower that threshold. So, absolutely, while you do have a genetically predetermined position for your threshold, you can move it.